Africa has no shortage of capable clinicians, but turning that expertise into research that can attract global funding and meet international standards remains a major challenge. That was the message from the Vice Chancellor of Yakubu Gowon University, Professor Hakeem Babatunde Fawahinmi, at a 2-day research capacity building and clinical research training program in Abuja.
As we all know, Africa does not lack capable clinicians. What has often been missing is the infrastructure, as we know, and the training that should turn clinical ideas and insights into fundable and internationally credible research. This is precisely the gap I believe that this program is built to close. And that gap we can only close with such an event, with the caliber of people we have here today. And as someone who has stood on the clinical side of the gap myself, I say this not as an outside observer.
Professor Obiageli Anodu, Director of Research and Grants at the West African College of Physicians, says Africa must build stronger homegrown research capacity and develop solutions tailored to its own health realities. She also urged emerging researchers to embrace mentorship, research networks, fellowships, and studies that address existing health challenges.
We have a disproportionate amount of, in terms of disease burden. If it's diabetes, if it is sickle cell, if it is cancer, our continent has a large share of the problems and very little of the resources and capacity to deal with them. We find that we are receptacle for studies that are done abroad, and very few of those studies are done on African population. And our genomics have told us that this is not a smart way to work because of the intense variety in the tremendous heterogeneity in the African genome. So we see as clinicians, we are working, we are seeing patients, we have questions, and we don't have the tools, with which to answer them. So this is what this workshop is designed to do, to help us to generate and develop the next generation of investigators. So for the young people, what I want to say is that you package yourself. This is not social media packaging, but you tool up, you acquire skills. There are so many. These days when I look at opportunities, so many of them are for young investigators, early career investigators, early career clinicians, so many training opportunities, so many. And I tell people, when you get one, you be responsible, you go and get trained, and you go back and, fit into, try and improve what you're doing. So you have to have, even for senior clinicians, you have to package yourself. You have to have a research kit, LinkedIn, a Google Scholar profile, and then you review the literature and you publish. Don't just start doing work. Going into systematic literature review, in-depth literature, so you see what is happening, you can appropriately direct your effort. Then be part of a research network. You have in this room care captive seats, and all of that. These are research networks deliberately built to deliver this kind of high-level science. And then, if you're very brilliant, and most people, you have a humble attitude. Don't be cocky. Don't flaunt yourself. Don't annoy your seniors. Because if you do, they will kill you. Don't annoy them. Don't, like this, you understand. Don't do that. Because you want to go a long way and you need the senior people to help you and to show you how they have done it. So please have a humble attitude. 2 years ago, somebody got a grant, a big one in my institution. I was director of research, and she said, "Oh, I'm going to this next conference and I'm going to show them that I said, do not do that. Don't do that." So a cocky attitude will make you unnecessary enemies, and then seek mentorship. So a mentor can open doors for you. and it's a lifelong relationship. And when you're giving advice, so because some people will come and say, "Oh, I want you to be my mentor," and then you tell them, and you don't ever see them again. So when you're giving advice, follow through. Report what you're doing. Check your emails is very important. Ask questions and don't be a free rider. If you're working in a group and there's work to be done, do your own part. Ask to be given an assignment when you're starting, even when you're older. You should do that. If you're young, start with fellowships. There are so many of them that can train you and equip you to be able to contribute your bit later. So be very clear on what you want to do. Show how it solves an existing problem. And you're more likely to get help if you intend to return and use the skills back home.
Professor Folakemi Odedina of Mayo Clinic Comprehensive Cancer Center says collaboration will be critical, advocating what she calls consortium science, bringing researchers and institutions together around shared goals rather than working in isolation.
Just introducing the consortia that we have at Mayo Clinic is the complexity of the disease that we're trying to deal with. Concrete cancer is very complex. And very early on in 2004, I did realize this because it was just impossible to be able to, my area of work is prostate cancer. It was impossible to be able to really understand and address prostate cancer effectively by just working in my silos and just with my team of people that I work with. So what is Cancer Consortium? When you think about Cancer Consortium, it's a collaborative network of institutions, researchers, and organizations that work collaboratively together to be able to advance cancer research and also all cancer care across the cancer care continuum. So what happens is when you are defining a consortium, so that this is where everybody really needs to understand this. One of the key things that I want to say about a consortium is that we leave your ego behind. A consortium is not led by us thinking that, as Professor Nodu said, I am important, I am important. It's not an I, it's a we. And we can only be important when we see each other as equals, regardless. From prostate cancer or from cancer advocates, patients, all the way to the big professors and the early stage investigators and the allied health research coordinators that we could never do without. We are all equal and we should see ourselves as being equal. So the way a consortium then works is a group of multiple individuals with complementary expertise and resources that are focused on solving a particular problem. And you can imagine how difficult this is because the group needs to think together, they need to work together, they need to collaborate as equals, they need to have shared leadership. And believe me, there's some people that don't want to give power up, but you have to have that idea. Sometimes I will lead, sometimes Professor Nodu will lead, sometimes Professor Monisi will lead, sometimes somebody else will lead, which is fine. And then they have to trust each other. If you don't have trust, then you're not going to have a good thing.
The program brings together Nigerian and international partners, including the Federal Ministry of Health, to strengthen Africa's capacity to turn clinical expertise into research, evidence, and homegrown health solutions.
We have been working with CAPTC for a very long time and have demonstrated an uncommon capacity and willingness to build capacity across Africa and especially in Nigeria, to be able to conduct high cutting-edge research. So this is going to be training those who are on the field conducting this research. So it cuts across different cancer areas, but the CAPTC, for example, focus on prostate cancer. Okay, but care goes beyond prostate cancer. Now we are going into other cancers. Okay, so if you hear Professor Odedina talk about having different consortia for liver, for blood cancers, some for liver, pancreas, cancers. So it goes beyond just a particular cancer. So we are building capacity for people to be able to conduct research across different cancer areas.